Whether during foreplay or the main event, using fingers thoughtfully can create profound pleasure for many women, when done with intention, sensitivity, and respect. With patience and the right technique, some women are able to reach orgasm through manual stimulation alone. Fingers offer an adaptability that many toys or rigid objects cannot. They bend, change angle, modulate pressure, and scale from a single fingertip to 2 or 3, making them exquisitely precise instruments you can tune in real time. I'm Dr. Susan Bliss, and I'll guide you through a respectful, medically grounded, step-by-step approach to using your hands so the woman with you feels safe, visible, and deeply pleasured. Before you touch, 2 essentials: consent and preparation. Begin with a clear, simple question, not presumptive, not rushed. For example, would you like me to touch you here? Keep language gentle and open so she can say yes, no, or guide you with specifics. Communication should be ongoing. Check in often with brief prompts and listen to tone as much as words. Preparation is practical. Trim and file nails until they're rounded and smooth. Wash your hands thoroughly, including under the nails, with warm water and soap, and remove any jewelry that could catch skin. If you expect lower natural lubrication, have an unscented, water-based lubricant within reach. Clean, well-prepared hands reduce the risk of microabrasions or infection, and lube reduces friction. Both are basic acts of care that show you're thinking about her comfort. Start with a deliberate warm-up and teasing. For many women, arousal unfolds across the whole body rather than flicking on like a switch. Begin away from the genitals. Kiss slowly, linger on the neck, trace the collarbones, and tenderly explore the inner arms. Use broad, languid strokes over the lower back, hips, and outer thighs to invite relaxation and curiosity. As you near the inner thighs, consciously slow your movements. Over clothing or underwear, rest the palm gently over the vulval area for a few seconds and then lift. That on-off pressure is fertile ground for anticipation. Trace the edges of fabric with a fingertip so the approach feels deliberate and teasing, not clumsy. Remember, teasing isn't just padding, it fuels the system, increasing blood flow to the clitoris, labia, and vaginal opening, so later touch lands with more intensity and pleasure. Move next to external touch, slow, light, and exploratory. Keep underwear on at first and use soft, measured strokes to outline the outer labia and the inner thighs. Pay attention to whether she invites skin-to-skin contact. When she does, slide a fingertip along the outer lips and then along the inner lips with a curious, unhurried rhythm. Initially, avoid direct, blunt contact with the exposed clitoral glands. For many women, that is overwhelming early in arousal. Instead, focus on feather-like strokes and gentle circles around the clitoral hood. Start with the lightest touch, then progress to delicate circular or oval motions that grow slightly firmer only in response to her cues. Watch for breath changes, little hip lifts, or soft sounds. Those microsignals are your permission and your roadmap. Once she's responding to touch, introduce rhythm around the clitoral area. Sensitivity varies widely, but a reliable pattern for many is consistent, repeatable motion rather than haphazard pokes. Experiment with a slow around-the-clock circle just outside the hood, or try vertical strokes from the pubic mound down toward the vaginal opening and back up. Figure 8 motions around the hood can create a pleasantly complex stimulus that some women prefer. Use a single fingertip if she seems to favor precise pressure, or join 2 fingers for broader contact if she wants more surface stimulation. Ask short, specific control questions, softer or firmer, faster or slower, higher or lower, and adapt immediately to the answer. Deciding when to go inside requires checking in. Moisture is a sign of arousal, but not always a green light for internal penetration. Ask, simply, would you like me inside? If she consents and you're moving forward, add lubricant as needed and begin with 1 finger. Never insert a dry finger. Enter slowly at the vaginal entrance and pause just inside to give her pelvic floor a moment to relax. A gradual come here curl is more effective and comfortable than fast in and out thrusting. Fingers excel at finding angles and applying sustained pressure rather than producing speed. Explore gently a few millimeters in different directions. Up, down, left, right, and if she tenses, withdraw slightly and return to external stimulation while you breathe together. Seek the anterior sweet spot with careful, tuned exploration. About 1 to 2 inches inside on the front anterior wall, you may feel tissue that's slightly spongy or subtly ridged. This area often becomes more pronounced as arousal grows. Curl the fingertip toward it in that slow come here motion and begin with light taps or short strokes. Build pressure only in response to positive cues. Body leaning in, clearer breathing patterns, verbal encouragement, because many women value a steady, repeatable rhythm more than raw force. Use your free hand to steady a hip, stroke the lower abdomen, or add gentle external clitoral stimulation with the pad of your thumb for blended pleasure if she likes combined sensations. If she asks for more fullness, scale thoughtfully to 2 fingers with coordination and care. Partially withdraw, twist slightly, and insert 2 well-lubricated fingers together, keeping them relaxed so they follow the contour of the anterior wall. Maintain the curl so your fingertips maintain contact with the target area, and combine internal motions, small come here pulls or tiny arcs, with steady external patterns from your other hand. Small, precise movements often become more potent as arousal peaks. The more lubricated and responsive she becomes, the less large, sweeping motions are necessary. Consistency and the right amount of pressure, delivered reliably, will usually be far more effective than frantic vigor. As she approaches climax, pay close attention to intensifying cues and hold what's working. Her breathing may quicken and become shallower. Her hips may press into your hand. Her vocalizations might deepen, and thighs may tremble. When you discover a pressure and rhythm her body is clearly following, resist the instinct to change it. Stability becomes an anchor at the edge of release. If she says, right there, honor that like a lighthouse. Keep the pattern and the pressure steady through the peak. Abrupt changes in stimulation in the final moments can prematurely derail or dull a climax for many women, so patience here is a true gift. Mix in gentle variations that many women enjoy to prevent habituation and to tune stimulation to her current state. Try hood strokes that glide the tissue without exposing the glands. Form a soft V with 2 fingers to cradle the labia. Slide the hood up and down beneath the tip for friction that feels contained. Or trace an outer to inner wave from the outer thighs into the labia to reset sensitivity between peaks. A warm, broad palm held lightly over the vulval area can be soothing and grounding when pressure holds are desired between intense moments. If angle matters, a small pillow under her hips can tilt the anterior wall toward your fingers and make contact easier and more effective. Always keep hygiene and comfort front of mind. Short, smooth nails, clean hands, and adequate lubrication significantly reduce the risk of micro tears. If you've touched the anus at any point and then returned to the vulva or vagina, change gloves or wash thoroughly before continuing. If she reports burning or sharp pain, stop immediately. Add more lubricant if the sensation seems friction-related, and revert to external touch while checking in. Mild stretching or warmth may be normal if she consents, but sharp, persistent pain is a clear no. Pause and reassess with gentle, open conversation. Aftercare matters as much as the act itself. Immediately after a peak, keep your touch steady but gradually lighten pressure as her body unwinds and the muscles release. Many women appreciate being held, a soft stroke on the ribs or hair, or a gentle thigh massage as their nervous system settles. Offer water and let silence or soothing words fill the space. Then, when she's ready, ask one concise question. What did you like most? Store that answer. It's the practical intelligence you'll use the next time. Those preferences are the real playbook more than any single technique. There are a few broader truths most men rarely hear but should internalize. Not every woman climaxes from internal stimulation alone, and that is completely normal. Some women prefer purely clitoral stimulation. Others enjoy a blend of external and internal touch. The most reliable way to know is to watch her body, listen carefully, and ask briefly and respectfully. Emotional tone matters enormously. When a woman feels safe, admired, and unrushed, blood flow and lubrication improve, the pelvic floor relaxes, and pleasure becomes more accessible. If you found this guidance helpful, consider sharing it with someone who seeks respectful, evidence-informed direction. Your hands, used with patience, accuracy, and genuine care, can be extraordinary instruments of pleasure. For men interested in complementary ways to support sexual performance, some choose to explore natural supplements, but approach these thoughtfully and consult a healthcare professional before starting anything new. Ingredients commonly discussed include watermelon extract for its amino acids that support circulation, and herbal blends that combine tonkatali, fenugreek, nettle, and similar botanicals aimed at supporting stamina and overall male reproductive health. If you consider such options, read labels carefully, prioritize reputable manufacturers, and discuss them with your clinician so choices fit your personal health picture. Immediately after a peak, keep touch steady while you lightly reduce pressure so her breathing and muscles can settle. Many women enjoy being held, stroked on the ribs or hair, or offered a light thigh massage. Offer water, and then, when she feels calm and open, ask one short question: what did you like most? Remember that answer. It is your most reliable map for next time. External touch. Refine the language of contact, mapping sensation to response. Begin by tuning the texture and tempo of your fingertips. They are the translators between intent and sensation. Lightly run the pads of your fingers along the outer labia, tracing deliberate paths rather than erratic pokes. Use the full length of a fingertip for a broader, softer sensation, and the very tip for pinpoint pressure. Alternate between them so the nervous system stays engaged. When sliding along the inner lips, keep motions slow and inquisitive, as if you're learning the contours for the first time. This invites curiosity rather than expectation. If she prefers skin-to-skin contact, soften the movement and let your fingers linger in one place for a breath or two before drifting. When contact near the clitoral hood begins, favor indirect stimulation. Circles around the hood, light sweeps across the mons, subtle valleys of pressure along the labial folds, because many women find direct stimulation of the glands too intense until later. Throughout, keep your hands relaxed and your wrists supple so your touch reads as fluid, not mechanical. Layer sensory contrast to deepen arousal. Combine soft fingertip work with alternating temperature and texture. The warm press of a palm, the cool glide of a breath, the faint scratch of fingertips along fabric. Tiny pauses, moments where you withdraw attention and then return, amplify what follows. Anticipation heightens neural sensitivity. Use your other hand to create supportive, non-sexual contact. Rest it on the small of her back, the outer thigh, or the hip bone, to communicate presence and steadiness. These anchored touches reinforce that she's cared for, which biologically lowers guard and fosters greater receptivity to pleasure. Read nonverbal signals as primary feedback. Breath, micro-movements of the hips, pelvic tilts toward or away from your hand, and involuntary vocalizations tell you far more than words sometimes do. Slow inhalations followed by soft exhalations usually indicate relaxation, while shallow, quick breaths often mark rising arousal. If she nudges your hand or guides your fingers, mirror that change immediately. If she pulls away, pause and ask a neutral, caring question. Too much? Want me to slow? Then honor her reply without defensiveness. When she invites more intensity, modulate surface area before force. Widening the contact, using 2 fingers, the flat of a thumb, or the pad of your hand, often reduces the sensation's sharpness while increasing its pleasant fullness. Conversely, narrowing to a single, well-lubricated fingertip allows precision and concentrated pressure for those who prefer it. Movement quality matters. Steadiness and predictability build trust, whereas abrupt or erratic changes can disconnect sensation from pleasure. Think of your hand as an instrument that plays phrases, repeatable motifs that she can learn and respond to, rather than random percussion. Integrate verbal microchecks as warm punctuation, not interrogation. Short, loving prompts. Is this good? Do you want more? Here or a little higher? Keep consent active and empower her to shape the experience. Avoid long lists of questions or performance-focused commentary. Keep language simple and focused on her comfort and pleasure. When she answers, adjust immediately and with gratitude. These small recalibrations compound into a clear pattern of mutual attunement. Position and ergonomics. Small adjustments make big differences. If your angle feels awkward, change positions instead of forcing the motion. Have her shift her pelvis, lift a knee, or move a pillow under her hips to expose the anterior wall more readily. These tiny mechanical changes can open up access without increasing force. For seated or face-to-face positions, support her lower back so her pelvis tilts naturally. For side-by-side or spooning positions, use your free arm to cradle and guide rather than reach awkwardly. Comfort for both partners sustains longer, higher-quality connection. Troubleshooting common concerns with care and clarity. If sensation is diffuse or she seems disconnected, slow the pace and return to broader, more exploratory strokes that re-establish arousal. If sensitivity spikes into discomfort, back away and reframe to gentler external touches while checking in. Burning, sharp, or stabbing pain requires immediate cessation and, if persistent, medical attention. If arousal plateaus, vary rhythm, change textures, or add a soft clitoral pressure with the pad of the thumb while maintaining an internal rhythm. Alternating between inside and outside stimulation often restarts responsiveness. Emotional context and safety rituals. Pleasure is inseparable from emotional safety for many women. Use language that affirms rather than objectifies. Compliments on how she looks or how she's responding are useful only when they center her experience rather than your entitlement. Little rituals, asking if she wants to dim lights, offering a towel, checking the room temperature, signal forethought and respect. Attentive aftercare, the gentle hand on a shoulder, the offer of a glass of water, the moment of quiet closeness, reinforces that the encounter was shared and valued, not transactional. Practice and reflective learning. Encourage a mindset of curiosity rather than mastery. Every woman's anatomy and preferences vary, and many change over time, cycle, or mood. After an intimate session, saving a single note to remember what she enjoyed, pressure, rhythm, a position, translates into meaningful improvement. If you are the giver, take time outside encounters to reflect on what cues reliably indicated progress and which changes disrupted momentum. If you are the receiver, offering concise, positive guidance helps your partner learn faster and feel more competent. Final reminders on boundaries, health, and resources. Always prioritize consent and immediate comfort above any goal of reaching orgasm. Maintain hygienic practices to reduce risk and communicate openly about sexual health status and any concerns. When considering supplements or adjuncts for sexual performance, consult a healthcare provider. Natural does not automatically mean safe for an individual, especially in the context of medications or existing conditions. Reliable, respectful education, sourced from clinicians and peer-reviewed literature, will always be a better long-term guide than marketing claims. Keep curiosity, patience, and kindness at the center of every touch. When technical skill is paired with genuine care, hands become not just tools but instruments of connection. When deepening external touch, let your movements echo a rhythm rather than random gestures. Establish a baseline pace she can trust. Slow circles, gentle vertical sweeps, or steady side-to-side motions before layering in variety. Women often find that consistency itself is erotic because the body can predict and lean into the sensation. Once the baseline feels stable, add small deviations. A pause, a shift in direction, or a change in pressure, always returning to the familiar rhythm. This combination of trust and surprise fuels anticipation and magnifies arousal. Imagine it as music. The steady beat grounds her, while the occasional accent or flourish awakens new attention. As you begin clitoral-focused stimulation, keep in mind that sensitivity shifts moment to moment. Early on, she may prefer indirect contact around the hood, with feather-light strokes that feel teasing rather than overwhelming. As arousal builds, direct contact with the glands might become not only tolerable but intensely pleasurable. Respect this fluidity by checking in softly. Do you want me here? And by attuning to nonverbal cues, such as her hips pressing into your hand or her breath catching at certain angles. Start broad and gentle, then narrow and intensify only when her body signals readiness. Introduce rhythm with precision. The clitoris responds well to repeated, consistent patterns because repetition allows the nervous system to accumulate pleasure. Try moving in circles that trace the edge of the hood, avoiding sudden darts. Experiment with vertical strokes, starting from the pubic mound and moving downward toward the vaginal entrance, then slowly back up. Add side-to-side motions that create a figure-8 pattern for variety. Use the flat pads of 2 fingers if she likes a diffuse sensation, or a single fingertip if she prefers sharp precision. Every adjustment should come in response to her body's feedback, not assumption. Blend touch with communication. Keep your questions brief and to the point, softer or firmer. Do you want faster? Should I stay higher or lower? These small questions empower her to shape the experience without breaking immersion. Avoid long discussions mid-stimulation. Save detailed conversations for aftercare. During the act, brevity and responsiveness build confidence in you as a partner and let her trust that you are following her cues moment by moment. When considering penetration, separate the signals of arousal from readiness. Wetness can indicate excitement, but it does not automatically mean she is prepared for internal touch. Pause and ask, "Would you like me inside?" That directness respects her autonomy and prevents assumption. If she consents, apply lubricant generously. Never attempt to insert a finger dry. Slide in slowly, stopping just inside the entrance so her muscles can adapt. Patience here is crucial. Rushing can create discomfort that lingers. Use the natural curl of your finger to make gentle, come here motions toward the anterior wall. Think of exploration, not thrusting. Fingers excel at subtle angles, deliberate pressure, and targeted contact rather than speed. As you explore internally, tune into muscle tension. If her pelvic floor tightens, that's a sign to pause, withdraw slightly, and return to soothing external stimulation until she relaxes. Breathe with her. Slower exhalations can cue her nervous system to soften and open. Reintroduce internal touch only when she feels comfortable again. This back and forth builds trust and prevents discomfort from becoming associated with penetration. Locating the anterior sweet zone requires sensitivity and patience. About 1 to 2 inches inside, on the front wall facing her belly, you may feel a spongy, ridged texture distinct from surrounding tissue. This area, sometimes described as the G-spot, becomes more noticeable as arousal increases. Approach it gradually, beginning with light strokes or taps. Increase pressure only when her body leans into your touch, or she verbally asks for more. Many women prefer rhythm over force, so maintain steady, predictable motions rather than harsh intensity. Use your free hand for grounding touches. Cradle her hip, stroke her abdomen, or circle her clitoral hood with your thumb. This blended stimulation often creates a richer experience than internal touch alone. If she desires greater fullness, introduce 2 fingers thoughtfully. Withdraw slightly, angle your hand, and insert 2 well-lubricated fingers together while maintaining contact with the anterior wall. Keep the natural curl so your fingertips rest against the sensitive area and coordinate with your other hand. Internal fingers can perform small curved motions, while the thumb or other hand sustains rhythmic circles externally. This harmony between inside and outside sensations often becomes the key to profound pleasure. Remember, smaller, controlled movements are usually more powerful than exaggerated thrusts. As arousal climbs, precision and steadiness matter more than scale. Approaching climax, anchor yourself in her cues. Watch for hips pressing rhythmically into your hand, breath quickening into short bursts, or thighs beginning to quiver. These are signals that she is near release. When you find the pressure and rhythm her body aligns with, stay there. Do not vary or escalate at the last second. Stability is crucial. If she whispers right there, treat those words as sacred instruction. Many climaxes falter because the giver changes the pace or angle too abruptly near the finish line. Your role is to hold the course until her body fully resolves the wave. Variations can enrich the journey. Try clitoral hood strokes where 2 fingers form a gentle V, sliding the tissue without fully exposing the tip. Explore outer to inner waves that start on the thighs, move inward to the labia, then drift outward again, resetting sensitivity while maintaining flow. Apply a broad, warm palm over the vulva as a pressure hold. This can be grounding between peaks. Adjust her angle with a small pillow under the hips, making it easier for your fingers to connect with the anterior wall. Each variation should be tested slowly and retained only if her body responds positively. Hygiene and comfort are the quiet guardians of pleasure. Clean, well-trimmed nails prevent accidental scratches, and thorough hand washing eliminates bacteria that could cause irritation or infection. Lubrication, whether natural or applied, is not an optional extra. It is essential for comfort, reducing friction, and ensuring sensations are felt as pleasure rather than abrasion. If at any point you transition from anal play to vulval or vaginal contact, wash your hands or change gloves before continuing. Cross-contamination is a serious risk that can interrupt intimacy and harm her health. Listen carefully to her body's language. Warmth or gentle stretching may be welcome, but sharp pain or burning is always a stop signal. Respond immediately with care, not frustration, and return to what feels safe and soothing. Aftercare is the closing note of this intimate symphony, and it matters just as much as the earlier steps. Immediately after climax, resist the urge to pull away quickly. Instead, keep your touch steady but soften the pressure as her body unwinds. Offer presence, not performance. Hold her, stroke her ribs or her hair, massage her thighs lightly. These gestures help her nervous system transition from peak arousal to calm. A glass of water, a whispered affirmation, or simply lying together can deepen connection. Later, when she feels ready, ask a single open question such as, "What did you like most?" Her answer is more valuable than any manual because it reflects her unique body and preferences. Store that wisdom carefully. It becomes the foundation of every future encounter. A few truths deserve repeating. Not every woman climaxes from penetration, and that does not mean she is broken or lacking. Many women prefer clitoral stimulation exclusively, while others thrive on a blend of external and internal touch. The only way to know is to stay present, listen, and ask. Remember, too, that the emotional atmosphere profoundly shapes physical response. When she feels safe, cherished, and unrushed, her body can open fully, blood flow improves, lubrication increases, and muscle tension dissolves into relaxation. Pleasure is not just a matter of technique, it is also a reflection of trust and emotional resonance. If this guidance resonates with you, consider sharing it with others who seek a respectful, evidence-informed approach. Your hands are not merely tools, they are extensions of care, accuracy, and patience. When used with thoughtfulness, they can create an experience that is not only physically pleasurable, but emotionally affirming. For men who want to complement skill with broader support for sexual health, natural supplements are sometimes considered. Compounds like organic watermelon extract, rich in the amino acid citrulline, may support nitric oxide production and circulation. Herbal formulas combining tonkat ali, fenugreek, nettle root, and similar botanicals are marketed for supporting stamina, testosterone, and prostate health. If you explore these, choose reputable sources and consult a healthcare provider to ensure they align with your individual health needs. Remember, supplements are an addition, not a replacement, for communication, skill, and care. At the heart of it all, the real secret is patience, paired with curiosity. Explore slowly, ask often, and let her responses guide your hands more than any external script. When technique is married to empathy, touch becomes not only a means of stimulation but a language of connection.